Hi guys, welcome back to my channel. In this class we'll learn about management of diabetes mellitus. Okay, first now, okay. By now you know that diabetes cannot be cured but can be treated so an individual leads a normal life, which means diabetic is not cured, means it doesn't have a complete cure, but people can lead individual normal life by maintaining diabetes and by managing the diabetes along with some changes in daily life. Okay, patients who can maintain their blood glucose level within normal range. Comment what is the normal range of blood glucose level. Okay, suffer from less complications will be there is no such thing that there will be no complications if you manage the diabetes. Complications are there, but if you maintain them in a longer period of time, the complications will show. If you don't maintain that, chronic complications may become acute complications. Okay, next one, a good synchronization between diet and lifestyle and drugs. It is mainly due to diet and lifestyle changes for diabetes. If you want to maintain and manage diabetes, simply change your diet and lifestyle, which is according to your blood glucose level and according to your lifestyle, but not according to your own thinking. Okay, as a dietitian, our key objective involves bringing out of lifelong adaptable quantitative and qualitative changes in nutrition intake, dietary habits, and food choices of patients as per their insulin and drug dosage. Mainly the nutrient intake, dietary habits, and food choices is mainly balanced between insulin, whether they are insulin dependent or drug independent. It mainly varies by these two components, and lifestyles also. Okay, whether they are sedentary or light or heavy work, based on that. Okay, the dietitian should work in close coordination with the doctor, along with the doctor, because even they prescribe drug and insulin, we have to, because each and every patient are different from the one another, so we should give what is the most appropriate and most manageable within their limit. Okay, next one, the patient can manage. It should be manageable to the patient. Next one, we will now discuss the dietary management of diabetes. Okay, see, it's saying modifications, lifestyle modification, whether it's drug or insulin dependent, these all comes under the holistic approach of the insulin. Next one, management of diet. Diet plays a important role in management of diabetes as it exerts direct influence on blood glucose level. As I already said, blood glucose level increases when we take carbohydrate or sugar content, have increased amount of blood glucose and carbohydrate content. Okay, so main vital components is to control the blood glucose level by controlling the carbohydrate intake and fat intake. Okay, next one, the goals of diabetic. Okay, diabetes control is mainly medical, exercise, behavioral aspect. It should be holistic approach, and we have to take all other, which means medical history and their exercise history and their behavior aspect, their likes, dislikes, everything should be taken into consideration before planning a diet or nutritional therapy for a patient. The goal of diet therapy are to maintain the prolonged health and productive and which helps in productive and happy life of a patient. Okay, this means nutritional assessment in important for setting of practical and acceptable goals for the patient. Goal that the patient can comprehend, relate to, can be followed easily only after we plan a diet and execute it. If you have planned a diet but patient is not following, then it's all waste. By planning the diet, you should also monitor that whether a diet is implementing or executed by the patient or not. Okay, next one, clinical parameters should be monitored from time to time in order to improve adherence. As I said, clinical parameters are, as I said, even if you execute it, we how can we know if it's managing, whether the patient is able to managing or not? It's mainly due to clinical parameters. Clinical parameters show how well they are managing the diet and executing the diet, how good they are able to manage and execute the diet we have given. Okay, next one, diabetics should be individualized based on nutritional status of patient. As I said, every patient have different condition and different statistics. Okay, so every patient is considered equally important and every patient is should be and have a personalized diet based on their nutritional assessment and everything. Okay, it should be practical, suited to the needs of the patient. Okay, so these are the questions. What are the dietary goals? Supply optimum nutrition to, well, they are supply optimum nutrition to patient, provide calories for maintaining ideal weight and normal growth and development, maintain blood sugar levels, glycemic control mainly, achieve optimum lipid levels. Lipid level because insulin, on the first class I have told, write about the why I am saying achieve optimum blood lipid levels. Okay, what is the reason behind it? You have to comment down in the section. Minimize acute and chronic complications of diabetes. Just list out the what are acute and chronic complications of the diabetes. Okay, next class we'll learn about what are the targets and how well we can achieve them.